Hi, hope you're all doing fine. In this video, let's discuss a few important topics in General Path. So I've shared the soft copy of questions in our Google group. You can download that and you can simultaneously watch this discussion, right? So coming to the first question, Carnification refers to post-pneumonic fibrosis, pleural effusion, empyema, all of the above. So what is carnification? See, usually in lobar pneumonia, there is exudate formation which undergoes resolution. But in 3% of the cases, rather than having this resolution of exudate, there can be organization. So it's nothing but ingrowth of fibroblasts from the alveolar septa, leading to formation of a fibrosed, tough, airless and leathery lung tissue. So carnification is nothing but post-pneumonic fibrosis because of organization rather than resolution of exudate. So option A is more appropriate, right? And then coming to the next question, vitamin C is oxidizing substance, reducing substance, both, none of the above. So as you know, we have few vitamins which act as antioxidants like vitamin A, vitamin C and vitamin E, tocopherol. So of these, obviously the question is on vitamin C. So vitamin C is antioxidant and it's a reducing substance. So apart from antioxidant property, as you know the functions of vitamin C, it also has an important role in hydroxylation of dopamine to noradrenaline or norepinephrine. And also it helps in maintaining the folic acid levels by preventing oxidation of tetrahydrofolate. And it plays a significant role in iron metabolism, in absorption of iron, in storage of iron, and also helps to keep iron in reduced state. So these are some of the additional functions of vitamin C apart from the regular antioxidant property. In fact, all these are because, or these can be attributed for the reducing property of vitamin C, right? So vitamin C is a reducing substance which has the following functions, right? So it's an antioxidant and also it plays an important role in hydroxylation, maintenance of folic acid levels, and has a key role in iron metabolism, right? I hope it's clear. So option B is right answer. Next, coming to the third one, Kangri cancer is squamous cell carcinoma, basal cell carcinoma, malignant melanoma, transitional cell carcinoma. So Kangri cancer is most commonly seen in Kashmiris, if you remember. It's named after Kangri, which is nothing but an earthen pot which contains burning charcoal, which is placed close to abdomen in order to keep themselves warm. It's most commonly seen in Kashmiris, and it's nothing but skin cancer, squamous cell carcinoma of skin of inner thighs as well as abdomen, as you can see here. So Kangri cancer, where the skin of inner thigh and lower abdomen is commonly involved. Kangri is nothing but an earthen pot with glowing charcoal, right? It's a kind of squamous cell carcinoma of skin, right? So option A is more appropriate. Now moving on to the fourth question. Normal levels of erythropoietin in plasma are, it's purely memory based, 15 to 20 units per liter, 25 to 30, 5 to 10, 10 to 25. So it is 10 to 25 units per liter, option D. In fact, erythropoietin, as you know, is a hormone which is produced by kidneys, and this erythropoietin has a very significant role in production of red blood cells. And as you know, the red blood cells' main function is to carry oxygen from lungs to different parts of the body, right? So in cases of anemia, in different conditions, we see fluctuating or varying levels of erythropoietin. This I feel very important. You can just make a note of this, right? Usually in case of anemias where we have low hemoglobin, low RBC content, more erythropoietin is produced as a feedback mechanism, right? So obviously in case of anemias, we have high levels of erythropoietin, except in anemias of chronic disease where the erythropoietin levels are almost normal. In case of kidney disease, obviously the erythropoietin production is hampered, so their levels are low in case of kidney disease. In case of polycythemia vera, even though there is erythrocytosis, increase in production of red blood cells, the erythropoietin levels are low. It's because of the fact that there is some abnormality in stem cell class, as it's mentioned in one of the textbooks. So in case of polycythemia vera, low levels of erythropoietin are because of abnormality in stem cells, right? So Normal levels of erythropoietin in plasma are 10 to 25 units per liter, right? Option D. Now coming to the final question, the earliest response which is seen in case of inflammation. So if you remember, we have vascular changes as well as cellular changes. So among the vascular changes, hemodynamic changes, the earliest response seen is transient vasoconstriction followed by persistent progressive vasodilation, right? And after which there is increase in local hydrostatic pressure, stasis of blood followed by margination, right? We have discussed all this in one of the textbook discussions previously. You can refer that for more information. So the earliest feature of inflammatory response includes, so what is the appropriate answer? Option A is elevation of local hydrostatic pressure. Option B, slowing or stasis of microcirculation. Option C, persistent progressive vasoconstriction. Option D, none. So it is option D, none. In fact, the earliest feature is, as I mentioned, transient vasoconstriction, right? Followed by persistent progressive vasodilation, following which there is elevation of local hydrostatic pressure, after which there is slowing or stasis of blood followed by leukocyte margination, right? I hope it's clear. So to summarize all that we have discussed so far, carnification is nothing but post-pneumonic organization or fibrosis, where there is fibrosed, tough, leathery lung tissue formation, which is seen in 3% of cases of lobar pneumonia, not because of resolution of exudate but because of organization, right? So thereby leading to formation of fibrosed, tough, leathery lung tissue, which is called as carnification. And then we have discussed about the role of vitamin C. It has this antioxidant property. It's a reducing substance. It promotes hydroxylation of dopamine to noradrenaline or norepinephrine, and it also helps in maintaining folic acid levels by preventing oxidation of tetrahydrofolate, and also plays a crucial role in iron metabolism, not just in absorption and storage, but also helps to keep iron in reduced state. And later we have discussed about Kangri cancer, which is a type of skin cancer, squamous cell carcinoma, seen commonly in Kashmiris. Kangri is nothing but an earthen pot with glowing charcoal, which is placed close to abdomen for sake of warmthness, right? And then we discussed about erythropoietin. What exactly is erythropoietin and its function? So it's a hormone produced by kidney, which has a key role in RBC production. RBC function you're all familiar with. So erythropoietin levels are usually high in case of anemias, low in case of kidney disease, and low in case of polycythemia vera, right? Because of abnormality of stem cells. And coming to the final aspect, we have discussed about various stages of inflammation, like what could be the first or earliest response in case of inflammation. So it is transient vasoconstriction followed by the subsequent sequelae of events, right? I hope it's clear.